Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi, everyone. I'm going to compare different methodologies of saliva and serum hormone assay methods. Believe it or not, it can very much change the results you get. And knowing which are the ways the companies are using will make all the difference for you and your patients when you make clinical decisions. One method is called ELISA. It uses antibodies to detect the quantity of different things. And it is microplated and coated with hormone-specific antibodies, and it's linked to an enzyme. It binds to the hormone, leading to what we call a chromogenic reaction, and it's measured by spectrophotometry. It is highly specific, it's sensitive, it's an antibody-antigen reaction. It's relatively simple and inexpensive, but there is a possibility of cross-reactivity because structurally similar molecules could give you a different answer. So it is limited. And by that, what I'm saying is there's a potential using ELISA. You may get a number that is not accurate for your patient. Then there's RIA, Radioimmunoassay. Now that uses radioactive labeled hormones that compete with unlabeled hormones to bind specific antibodies. The amount of radioactivity bound to an antibody is inversely proportional to the hormone, let's say it's a hormone concentration. It's highly sensitive method as well. It's use of radioisotopes. It's a well-established method. It's a historically reliable method, but problems are you have radioactive waste that needs to be disposed of. There's a short shelf life of these reagents, and it has to be used only by laboratories that have facilities that can handle radioactive type of material. The next methodology a lab may use is called Chemiluminescence Immunoassay, also known as CLIA, C-L-I-A. It is similar to ELISA, but it uses a chemiluminescent substrate instead of a chromogenic one by the enzyme. It emits light, and it's proportional to that what you're assaying for is concentration. It's highly sensitive. The results are faster than ELISA. There's a reduced interference due to cleaner signal-to-noise ratios. But the problem is it's more expensive than ELISA due to the reagents and detection equipment that's required for this. It's good for high throughput laboratories that need rapid results. And don't worry, I'm going to give you the best one. There's also something called FIA. FIA is Fluorescent Immunoassay. It is too also similar to ELISA, but it uses fluorescent label on the second antibody, and the intensity of the fluorescence measured by a fluorometer is proportional to the concentration. It's a higher sensitivity, by the way, than more dynamic than ELISA. But again, it requires special equipment for fluorescent detection. And the possibility of photo bleaching can impact the results of this particular methodology. It's more useful in research, by the way, where high sensitivity is paramount. Now let's get to the real thing. The real gold standard, which I'll say 2 or 3 times, is mass spectroscopy coupled with chromatography. It's also known as LC-MS/MS. It combines liquid chromatography with tandem mass spectroscopy, one after the second, for identifying and quantifying different things. And it is an easy way of doing it. For example, saliva, it first uses LC, and then it looks by the MS/MS. It is highly specific. It's highly sensitive, even with very low detection units. Sometimes it will look for things in parts per billions. And you could do multiple things at the same time with this kind of unit, meaning if you're doing hormones, you can look at multiple. Now, it requires special technical things. It is something that you need to have expensive equipment, but the truth is, it is the gold standard. Now, Let me do this one time again instead of going through RIA and FI, all the different ones. Let me just stick with the one that works, the one that is the gold standard, the one as a clinician, the one I would only use on my patients to get the accurate results that I need. Here's the one thing you take away. Mass spectroscopy coupled with chromatography, which we know is LC-MS/MS, is the most accurate mechanism or methodology a lab can use to determine pretty much any test you're looking for, whether it be hormone serum or hormone saliva, etc. It is superior specificity and sensitivity than any other method. And it does have the ability to measure multiple hormones or metabolites simultaneously. Now, if your goal is precision and versatility in complex analysis, and all patients, you have that, then there's only one type of methodology you should be thinking of. That's the LC-MS/MS. Thank you for watching. If you have any questions, you can always write me at DrMitch at drmitchgen.com. Thank you.